Call a member for Maitland.
Thank you, Ms Temporary Speaker. Madam Temporary Speaker. I encourage everyone to participate in National Palliative Care Week, which is being observed this week. It celebrates life whilst asking us to all plan ahead for end-of-life care and discuss those wishes with our family, friends and health professionals. Palliative care is very much in focus in my electorate, with two particular organisations taking a lead role in raising community awareness. The Volunteers for Palliative Care is a non-clinical palliative care support service which provides respite at no cost for palliative care patients, carers and their families. They provide a range of services to ensure people can spend time with the one they are caring for in their home. They work in partnership with and take referrals from the Hunter New England Health District, general practitioners and other palliative care non-government organisations. People can also self-refer into this service. The Volunteers have a very exciting project which is to establish their very own hospice in the Maitland area. Their coordinator, Judith Robinson, is a particularly strong advocate for this cause, and I know that even from when I ran as a candidate for election in 2015, she is such a passionate advocate for palliative care. I'm sure she will help our community to achieve this goal. The Volunteers held a fundraiser for this initiative a couple of weeks ago, which raised a substantial amount of money, and I thank all of their amazing supporters for the ongoing assistance. The Friends of Palliative Care assists and supports the providers of services within the local Hunter and are committed to promoting community awareness of the services that are available, as well as meeting the needs of terminally ill patients and their families and carers. The Friends held their annual walkathon last weekend, and I thank them again for all the work they do to raise funds. I was very sorry I missed that this weekend for the first time since I was elected, but I know that I was ably represented by Ms Maitland, Caitlin Hipwell. Maitland does not have a hospice. Rather, we have a virtual hospice, and we in recent years have struggled with a lack of funding by this government. In 2016, Maitland had one full-time equivalent palliative care physician. We saw the resignation of this doctor, Dr Susan Newton, recently after having called and not being heard for so long, just asking for more resources to meet the growing needs of our community for palliative care. When she was replaced, the government chose to replace her one full-time equivalent position with 1.5. However, one of the two staff that took up this position has now left, leaving us with 0.8 of a palliative care position in Maitland. This is of such concern to the broader palliative care community that I had a visit from Dr Yvonne McMaster in this place this week. I understand that there's a doctor on the Central Coast, this is from Dr Yvonne McMaster, that there's a doctor on the Central Coast who is willing and able to do the 0.7% of the FTE, but the position has not been advertised by Hunter New England Health. This is one of those stealthy cuts to health, Madam Temporary Speaker, which happens again and again in my community. Positions are put up there, but they are not filled, they're not resourced. This now leaves us in a situation where we have one person doing the job of 1.5 with half of the resources. It's an enormous increase in workload as well because of the doubling of hospitals that are now covered by the Maitland Palliative Care Service, with the addition of Cessnock and Kurri Kurri Hospital, as well as an ICU at Maitland Hospital. The task is growing ever without the resources. A review was promised on the provision of staffing in the palliative care service in Maitland, which covers Kurri Kurri, Cessnock and Dungog. The review has not been released, and so we are unaware of any recommendations to assist us in dealing with this this very great need, or indeed of the government's intentions as how they intend to fill that need. According to the Australian Institute of Health and Welfare data released recently, the number of Australians who've been admitted to hospital for palliative care has soared by nearly 30%, rising from about 57,600 in 2011 to 12 to almost 74,000 in 2015-2016. So I'm assuming that it would be even greater today, Mr Temporary Speaker. In 2015-16, cancer was responsible for about half of all of the admissions and deaths in palliative care patients. This is a really big crisis in my community. We have had some very strong representations from families such as that of the Murphy family, who watched their mother suffer night after night without being able to be administered pain relief, with confusion between ambulance services and the palliative care team and the local health district about who could administer injections, leaving this woman languishing in complete agony in the last weeks of her life. We all deserve better than this. I call on the government to fund our palliative care services properly and to ensure that people can die in dignity where they need to. Thank you.
Yeah, I call the